Hi everyone, welcome to my channel. My name is Midwife Sally. Today we are going to talk about induction of labor. Yes, when women are getting to 38, 39 weeks, 40, sometimes there's a lot of anxiety. They cannot wait anymore and they're asking, Midwife Sally, can I just go and request for induction? Yes, so in the first place, what is induction of labor? I'm going to do it like a conversation. There's a woman sitting right in front of me. She's been told she's going to do induction of labor and she's confused about it. What is it? Okay, so when we say induction of labor is just like you are going to give birth, okay? But in this type of birth, it is not happening spontaneously, meaning that it is not starting by itself, but the midwife or the doctor. Induction of labor is usually done by doctors. It's initiating the induction of labor. So that is what when we say induction of labor, that is what it means, that we are trying to artificially start the labor. Okay, and then there are so many ways they can do that. They can use just sweeping, membrane sweeping is a way of causing labor to start. Sometimes they will break the water. It's a way of causing labor to start. If the cervix is open already, let's say it is opening, but they want it to start. Okay, sometimes they use medication, which is the popular one. Put it, okay, at a particular position within the cervix, okay, and then it causes it to dilate, then labor sets in. So there are different ways of causing labor to set in. Underline the fact that I said that in this part, it is not your labor that has started, but we are trying to do it for a reason. So what are some of the reasons why induction of labor is done? Sometimes it is the woman, they've given you a time to deliver and the time has passed, so they have to bring the baby out. Okay. Sometimes to um let's say the woman is losing a lot of water, okay, your waters have broken but labor has not set in, they need to bring this baby out. Okay, so when they see that the risk of infection is high and they can end the pregnancy, they can use induction. Some women may have conditions like high blood pressure, and because of the high blood pressure, it is detrimental to their health, to the health of the baby. They would have to bring the baby out. Okay, or there's a woman who is in labor for a long time, or let's say the signs of labor is so obvious, but there's no progress or anything. They can also decide to do induction. So there are so many reasons why your doctor may decide to start labor artificially. But what I would want to add is that um, we, if there's no reason, they will not just start an induction, okay? And even for those who have reasons, it is not everybody who qualifies to do an induction of labor. So somebody will have, let's say, a previous scar. She has done a surgery before. People with sometimes even extremely high BPs, okay, and even the post date, if it is too much, they out and they will check your service. They call something bishop score. Okay, they will check it depending on your score. They will see whether the service is favorable or it is not favorable. So as I said, if you have all these conditions and they even examine you and then your service is not favorable or there's a reason why they feel like this woman, we don't think she should go through induction, let her go and do CS straight, they will also tell you. Okay, so all these things have to be discussed. Yes, and then let me say, some people say induction is more painful than normal birth. I haven't done it before, but that's what those who have done it say. Okay, so you can talk about pain management when you are doing the induction of labor. Okay, so if anything, they are going to give you medication to reduce the pain. Then obviously, one thing that a lot of people will say, where should you have your induction? Okay, have your induction in a hospital that has theater in case it doesn't go well, a hospital that has blood bank. Okay, there's when you're going to give birth, not only induction, but there's this risk that in case you are bleeding or anything, what happens? Okay, they will need to send you to the theater, they need induction and then monitoring. Once you are doing induction, you need very strict monitoring. So they will monitor the baby's heartbeat, every 30 minutes. They'll be monitoring you, the mother, the BP. So your general health condition, you need regular monitoring, like strict monitoring. And then the medication, in case you are going to be given medication, it has to be given by the doctor. It shouldn't be, there should be under no circumstance where you take the medication yourself, because anytime you are supposed to take the medication for induction or something, they need to examine you, your contractions, your cervix, and everything. So please, my emphasis is on the monitoring. Induction of labor can be very safe, but the monitoring, okay, if you do not get your doctors monitoring you, monitoring the baby, you speaking out when you feel any changes, okay, then the risk goes high if you are not being monitored well. So any hospital where they choose to do an induction for you, please ask your questions. Make sure you are, like, you feel safe and you are in good hands, not just anywhere. Okay, this will go a very, very long way to save you from a lot of problems. Okay, yeah, so that is what I will say about induction of labor. And I believe with this little